to our presentation on Social Security basics. And for Kim, I need to do some housekeeping items. Remember to stay logged in for the entire session and also submit the feedback survey, which has the attendance code words that I will give you throughout the presentation. Be sure to mute your microphones. It's just me looking at this, so I'm probably going to miss any conversations or raised hands. So I would say either, put your questions in chat and I'll get to them at the end, or if you want to just unmute and shout out a question, that'll be fine too. So I went looking for some cartoons on Social Security, and I will admit there's very few that are actually funny. But I did find a couple, and I put them in throughout the presentation. So here's a list of some of the things we're going to look at today. The basics, early retirement, delayed retirement, different spousal benefits, double dippers, which are the people who have government pensions as well as Social Security. I think we're all pretty familiar with the taxation of Social Security benefits. Going to touch on some Medicare, look at a few planning opportunities, and we're going to look at potential changes in the future for the Social Security Administration. So Social Security falls under the OASDI, which is the Social Security Old Age Survivors and Disability Insurance. So again, Social Security covers more than just retirement. It covers disability payments, payments to survivors of deceased workers, as well as taking care of Medicare hospital insurance. One of the things you want to be sure your clients understand is that Social Security is not enough money to retire on for most people. It's anticipated it will make up about 40% of your pre-retirement earnings. So they will need additional assets to maintain their lifestyle on retirement. They should practice some budgeting and maybe consult with the financial planner to help determine what level of assets they need to accumulate. I think we all understand that the funding for Social Security comes from payroll tax withholdings and self-employment tax. Your benefit is based on your highest 35 years of Social Security earnings. And again, these are Social Security earnings, not your Medicare earnings. Any earnings received before age 62 are indexed for inflation when they look at these 35 years. So to qualify for Social Security, you have to have what they call 40 quarterly credits. You can earn a quarter in each year by making at least $1,410, and that's for 2020. This is indexed for inflation. So really, if you make $5,640 in a year, that entitles you to 4 quarters for that year. They do not have to be made in separate quarters. They can be made in 1 month. They can be made over 12 months. And you can only earn up to 4 quarters per year. So when they average out these 35 years of monthly benefits, monthly earnings, that's referred to as the average indexed monthly earnings, or AMI, as they call it. If you haven't worked for 35 years, they use 0 as your wages for any years that you did not work. So this can really dilute your benefits. So most people, somebody in their car? Okay, better. Okay, so once your average index monthly earnings is determined, the next step is to determine your primary insurance amount, the PIA. This is the amount of the monthly This is the monthly payment amount you would receive at your full retirement age, which we will talk about in just a little bit. The formula for calculating your PIA is you get 90% of the first 926 of your indexed earnings. Then you receive 32% of the amount between 927 and 5583, but only 15% of any amount greater than 5583. So as you can see, the PIA is weighted to deliver proportionally more benefits to lower wage workers. You can set up an account online with the Social Security Agency, and they can estimate what your monthly benefits will be based on what year you retire. Now, they will assume any additional years worked, you're making the same wages that were last reported to them. So if you're considerably younger, you'd be projecting out much further in the future, and it's more likely that your benefit would be understated, since your earnings are likely to increase each year. I thought this was a good chart to show where the money from Social Security goes to. As you can see, 70% goes for retirement benefits. The next largest group is disabled workers. And in actuality, that 14% of people on disability are actually not at their full retirement age. Because if you're claiming disability, once you reach your full retirement age, they switch you out of disability insurance and into the retirement insurance. The remaining 17% of the outlays go to survivors, spouses, and children. I thought this was a really cute cartoon. I don't think I'd ever thought about Social Security as sort of being like a Ponzi scheme, but I guess it really is. Okay, our first code word for our CPA credit is Christmas. So code word number 1, Christmas. Okay, early retirement. So I referred to this earlier. Your full retirement age, which I'll sometimes reference as FRA, is based upon your date of birth. So full retirement age for most of those people working today will range from 66 to 67 years of age. And this increases based on certain monthly intervals. We'll see a chart of this in a little bit. So in general, it's assumed that a person who takes retirement early, which 62 is the earliest date you're eligible for benefits, based on your life expectancy, you'll receive the same amount of money as someone who claims their benefits after age 62. Depending on your date of birth, so to make up for the fact that you will be getting more checks than someone who delays their retirement benefits, your checks are going to be reduced. So depending on your date of birth, your monthly benefit could be reduced anywhere from 23 to 30% if you claim at the earliest possible date. Actuarially, you should receive the same amount as someone who retires at full retirement age or even later. Those delaying claiming a benefit do earn additional monthly benefits, which again, depending on your date of birth, could net you a 24 to 30% increase in your benefit. So I like this chart because it shows you several things. The first column is your year of birth. The second column shows what your full retirement age would be. That's when you would receive 100% of your normal benefit, or PIA, that I talked about earlier. The third column reflects the number of months between taking retirement at 62 and your full retirement age. And then the fourth column over just assumes, maybe your PIA at full retirement is $1,000. So for those born between 1943 and 1954, if they retire at 62, they're only going to get 75% of their $1,000 benefit amount. Because again, they're going to receive 48 more payments than somebody who waited until their full retirement age to claim. If you go down to the bottom of the chart, for someone born 1960 or later, their full retirement age is 67 years. So they're retiring 60 months earlier than their full retirement age, and their benefit will be reduced 30% for taking this earlier retirement. These spousal benefits, we'll talk a little bit more about that later. So one of the things people need to understand about early retirement is that if you can claim early retirement but continue to work for wages or self-employment income, your monthly benefit may be reduced based on how much you earn. So if you're under your full retirement age, making more than $18,240 in 2020, your benefit will be reduced $1 for every $2 you earn over that $18,240. In the year you reach full retirement age, your benefit is reduced $1 for every $3 you earned in excess. But once you reach your full retirement age month, there's no limit as to how much you can earn. Now, the amounts they withhold from your benefits before your full retirement age due to these earning limits are repaid to you after you reach full retirement age. So those payments are not lost. So people do have one chance at a do-over in terms of claiming early retirement. If within the first year, and that's a pretty hard fixed first year, you claimed early retirement, you decide and you change your mind, you can opt out of claiming benefits. But in order to do that, you have to repay all the funds you received for benefits since you started claiming. Now, that would include any Medicare premiums withheld or federal taxes withheld. This allows you the opportunity to increase your monthly benefit up to your full retirement age benefit. So in our example above, where someone would get $700 out of $1,000 for retiring early, they could back out and then work till their full retirement age and receive their $1,000. Now, if a year has passed, you can't do a do-over, but you can suspend your payments. But you do not increase your monthly benefit by earning more money after you suspend your benefits. Your base benefit is going to be based on the amount you were paid when you took your early retirement before you claim suspension. So just as you can take retirement early, you can also delay claiming your benefits. This is a choice each individual can make. Each year you delay claiming after your full retirement age earns you an increase in your monthly payment with a maximum final increase of 24 to 32%, again, depending on your date of birth and your full retirement age. Once you reach age 70, they no longer index your monthly benefit up. So there is no reason not to claim your Social Security at age 70, unless you just don't need the money and are okay with giving it back to the Social Security Administration. One thing that you need to keep in mind is delaying claiming your benefits can also increase the spousal survivor benefit if you are the higher wage earner. I bring that up now, and we're going to talk about this a little bit later as well. So here's a chart showing what your additional benefits will be by delaying, and also the age you would break even. So for a person who normally retired, whose full retirement age would be 67, and if they were going to earn a benefit of $1,404 at their full retirement age, this shows the amount of additional money they would receive each year by delaying. And it also will show you the age at which you would break even. So obviously at age 67, that is your full retirement age. So you receive your normal monthly benefit. Now, if you had retired earlier, the fourth column over shows that you would have received about $60,000 more in checks during the years 62 to 67. But if you live to approximately 79 years, you'll be better off with actually delaying your benefits. If we drop down to age 70, claiming your benefits at age 70, three years later, you've got a 24% increase in your monthly payment, but you did miss checks of $94,500 approximately from age 60 until that age 70. But if you live to be more than 80, you're pretty much going to break even. And with with the life expectancies today rising pretty quickly, most of us probably are going to live into your 80s. So there's a good chance that waiting till 70 would pay off for you. But again, it depends on a lot of situations, your health, your, what other assets you have. So spousal retirement benefits. At full retirement age for a married couple, each spouse is entitled to the larger of their own earned benefit, or if higher, they can take the 50% of their spouse's benefit. Now, in terms of a spousal benefit, this will never increase above 50% of your other spouse's benefits at their full retirement age. So even if that other spouse is delaying benefits until age 70, the spousal benefit will never be more than what the 50% of their benefit at their full retirement age. And again, if you claim early retirement using the spousal benefit versus your own, you're still subject to a discount for taking those payments early before your full retirement age. An individual may claim the 50% benefit of an ex-spouse if certain qualifications are met. Having been married 10 years, divorced 2 years, age 62, your former spouse must be eligible for benefits, though they do not have to be claiming them. So in general, they would need to be at least 62. And if you have an ex-spouse claiming on your benefit, this will in no way affect the amount of your benefit at your full retirement age or beyond. So actually, a person could have 3 ex-spouses claiming on their benefit, and it still won't affect the amount of money they receive when they retire. So currently, there's still one type of scenario that can help out married individuals. This is getting ready to disappear pretty soon. It's called restricted application. So this allows a worker to file only for spousal benefits, even if their own benefits might be higher. Then that worker, the one claiming the spousal benefits, can wait till age 70 to begin drawing their own benefits. This way, they receive the delayed retirement credits, which could be up to 32%. The trick here is you have to be born by January 1, 1954. So anybody that's still eligible for this is probably, what am I thinking here? At least age 66 by now. So they probably already made a decision to maybe delay retirement. And obviously this is only good for couples. So in order to claim a spousal benefit, the other spouse must be claiming benefits. So you can't both wait until age 70. So in order to use a restricted application, one person must begin claiming their benefits, and then the other can take the spousal benefit. I think year 2023 is going to be the final year this strategy will be available, as individuals born by January 1st, 1954 will all be age 70 as of January 1st, 2024. So this benefit will be over at that point in time. Upon the death of a spouse, their surviving spouse is entitled to the larger of their own benefit, or 100% of the deceased spouse's benefit. Again, this is if the survivor is at their full retirement age. If they claim before that, again, it's subject to those reductions for early retirement. So if a surviving spouse is under full retirement age when their spouse dies, they can switch to their own benefit payment if it's higher at their full retirement age. So the takeaway is, if one spouse wants to take early retirement, it should generally be the lower earning spouse. The 50% spousal benefits are based on a spouse's benefit at full retirement age and does not increase with delayed retirement. But their surviving spousal benefit, which can be 100% versus 50% of the spousal benefit, can be increased by delaying retirement. So if a higher earner claims early, I think I should have said their surviving spousal benefit will be much lower. So now we'll just touch real quick on double dippers. So people who are covered by public or government pensions sometimes are referred to as double dippers if they also collect Social Security. So some public and government employees are covered under a separate plan and they do not make contributions to the Social Security system while in those plans. But because they may retire early, they may find themselves with a second career spanning at least 10 years, making them eligible for Social Security in a traditional Social Security-based earnings. But there are two provisions that may reduce the amount of Social Security benefits these individuals may be entitled to. They're the windfall elimination provision, WEP, and the government pension offset. So the windfall elimination provision applies when you have the 40 Social Security credits to qualify for Social Security, but also have a pension from a non-Social Security system. So WEP may reduce your Social Security benefits, but it will never eliminate them altogether. The GPO only applies to Social Security benefits you may receive as a spousal or widow's benefit when the spouse or widow also receives a non-Social Security pension. The GPO does have the potential to totally eliminate any Social Security benefit payment. So code word number 2 for CPE is vacation. Code word number 2, vacation. I think somebody else used this as a code word in one of the earlier presentations. So I suspect most people watching this are pretty familiar with the federal taxation of Social Security. I won't go into it. You can get details in the instructions to the 1040, or you can take a look at IRS Pub 915. But retirement, survivor, disability, and child survivor benefits are all taxable benefits. You may hear of people who receive SSI, supplemental security income, and then there's also a lump sum death benefit, and neither of these are taxable. SSI benefits are a federal income supplement program, but they're funded by general tax revenues and not the Social Security Administration. These are designed to help the aged, blind, disabled, and low-income individuals to meet their basic needs. There are 13 states that tax some or all of Social Security benefits. And Medicare. Medicare is a pretty big portion of the Social Security program. You don't need to be collecting Social Security benefits in order to obtain Medicare coverage, but coverage is available when you reach age 65. So I'm sure you've all heard of the different Medicare Part A, B, C, whatever. So Medicare Part A covers most inpatient hospital, skilled nursing, home health, and hospice care. As long as you've been paying into the payroll system for 10 plus years or 40 quarters, you should be covered by Medicare. The 2020 deductible for a hospital stay of less than 60 days is $1,404, which is a pretty good deal. You can go to any hospital in the U.S. that accepts new Medicare patients. Now, after 60 days in the hospital, a daily coinsurance does apply. For 2020, that's $352 a day for days 61 through 90. And after 90 days, it goes up quite a bit. So once you pass that 60-day mark, it's going to cost you. And failure to sign up for Medicare Part A at age 65 will lead to a lifetime permanent increase in your Medicare Part A premiums. So it's very important that you sign up when you reach age 65. And there is a 6-month window around your birth date to enroll. It'd be 3 months before you turn 65, and then the 3 months following when you turn 65. That would be considered a timely enrollment. Medicare Part B covers doctor visits and other medical services that don't require inpatient hospital stays. Medicare B does involve a monthly premium that currently ranges from about $145 to $492 per month, and it's based on your income level. If you're obtaining Medicare B but aren't yet drawing Social Security, meaning maybe you're delaying your Social Security to age 70, you actually have to make a monthly payment to the Social Security Administration to pay these premiums. Once you begin receiving your Social Security benefits, they will deduct these premiums from your monthly checks. The Medicare annual B deductible for 2020 is $198, and thereafter it covers 80% of your expenses. So, and your Medicare B premiums for 2020 were based on your 2008 income tax return. So there's sort of a 2-year look back. So if a taxpayer has unusually high income in any one year, or this is a retired taxpayer, they can expect their Medicare B premiums to increase tremendously 2 years out. It will drop back down if their income drops back down. For 2020, the additional premium cost for higher income could be as much as $4,164 per year per person. So, for a joint couple, that's over $8,000. Tax planning could possibly help mitigate this effect. Another important note is that Medicare provides no long-term care benefits. So if you end up in a nursing home, that generally is not going to be covered by Medicare. So since Medicare A and B can still leave an individual with potentially huge out-of-pocket expenses, many individuals also enroll in a supplemental plan offered by private insurance companies. And these are referred to as Medicare Part C. This is referred to as Medicare Part C, but they're also called Medicare Advantage plans. These plans participate in Medicare Part A and B, and then each one offers varying additional coverages at varying costs. The private insurance carriers are in part reimbursed by Medicare for each enrolled individual for the A and B coverage. So Medicare Part D is a voluntary outpatient prescription drug plan. Again, this is offered through private insurance carriers, even though it's referred to as Medicare Part D. As with the Part C plans, coverage and cost may vary between insurance carriers. But also, as with Medicare Part A, if you delay enrollment beyond age 65, you can have increased premiums over your remaining lifetime. And then lastly, there are Medicare supplement plans, often referred to as Medigap policies. These are totally offered by private insurance companies and are not related to Medicare or Social Security at all. In 2020, there are 10 different Medigap policies to choose from. All the benefits, coverages, and pricing will vary between plans and between the different insurance companies. So you really have to shop around for these plans. So our code word number 3 for CPE credit is Chevy, or you could say Chevy. I intended it to be Chevy. I mean, excuse me, intended it to be Chevy, but it does look like Chevy. So code word number 3, Chevy or Chevy. I'm going to touch on a few planning opportunities here. For your clients that are nearing age 62, you may want to talk to them about whether they have considered any strategies to maximize their Social Security benefits, especially for couples. Make sure they've set up their Social Security account so they can obtain estimates of their anticipated benefits. For single individuals, there aren't a whole lot of strategies out there outside of delaying claiming your benefits until age 70 if you can. Discuss whether the client has other sources of income they could use in retirement until they reach age 70. So again, each year of delayed claiming earns you an 8% return, which isn't a bad return. And it's not fully taxable too. So be sure to ask your single taxpayer if they were previously married, as there may be a higher benefit available from an ex-spouse. Or potentially ask them if they have a deceased spouse. They may be able to claim a benefit from the deceased spouse. For married couples, there are several different strategies. You would likely need to obtain a lot of information, things like life expectancy, excuse me, age differences between the spouses, how's their health, planned employment after 62, what's their financial situation at this point, and what do they anticipate it to be, a little bit down the road. Especially important is, do they need to ensure security for a spouse and or children? Again, some strategies include one spouse files early, taking the discount on their benefit, while the second waits until age 70. If this is affordable, the lower earning spouse should generally claim first. In general, if you've got some pretty bad health issues, you probably want to go ahead and claim as early as possible. If the higher earner spouse is significantly older than the other spouse, you may want to consider delaying that older spouse's benefits until age 70, because that then ensures a higher survivor benefit for the younger spouse and or the dependents. I think as a practitioner, if you're serious about providing Social Security planning to your clients, it's probably best to invest in software. There's a lot of calculations here. I didn't really go through any examples of how to calculate this or that, but there's a whole lot of them, and there's a lot of things we didn't really even cover today. So the 3 that I came across in my research are listed here. They seem pretty reasonably priced, for an annual cost. If you'll notice the Social Security timing, if you're a fan of Michael Kitcey's, that's his top pick. And then for yourself personally, if you're curious about your potential benefits, there are a lot of online calculators available for free. So this cartoon's a little bit dated, but it seemed the perfect segue into my next slide. So potential changes to the Social Security system. So prior to the pandemic, it was estimated that the Social Security Trust Fund would be depleted by the year 2035. And at that point, benefits would need to be reduced by 20%. Now, it's likely that the pandemic has made this this date a little too optimistic, so it's probably going to happen before 2035. But there are several potential changes being looked at to bolster Social Security's future. These include moving the full retirement age from 67 to 70. They could eliminate the cap on taxable Social Security wages to make these wages comparable to Medicare wages. They could eliminate or reduce the delayed retirement credits. That's the 8% per year you receive for waiting to claim beyond full retirement age. They could delay early eligibility from age 62 to age 64. And I think with lifespans, increasing, these are probably the moving the full retirement age to 70 and early eligibility to 64. That probably could be a pretty likely candidate. Some people talk about reducing the cost of living adjustments. I think there'd be a pretty big uproar if they tried to do that. So I can't really see that happening. But there's talk about using a means testing to ensure that people that really don't need Social Security don't receive it or receive reduced amounts. There's talk about increasing the payroll tax rate above the current 6.2%. There's talk about removing the exclusion of some salary reduction plans from Social Security taxation. So like flexible spending accounts, your health insurance, they are not included in your Social Security earnings. And then there's talk about eliminating state and local government pensions. So these workers will have to contribute to and be covered by the Social Security system versus these private pensions. They all have their potential pros and cons, and I think we'll be probably hearing a lot more about these different options in the future. I put some Social Security websites on here that I found useful, and working on this presentation and doing some other reading and such. But there's a ton of stuff out there, so you probably don't, just Google Social Security and you'll find a myriad of sites that you could visit. Now I do have some handouts in a PDF format. I'm not giving them out to everybody because I'm not sure everybody would really want them. I have a glossary of Social Security related terms, and that is actually 24 pages long. Chart with the reductions and increases in benefits for taking early versus delayed retirement. The 10 Medigap policies that are currently available, and then a chart of projected benefit cuts based on the Social Security running out of money. If you'd like me to send you those handouts, just shoot me an email. I've got my email there, and I think on the title page, gcard@hansmanweeble.com, and I can send you copies of these handouts in a PDF. I hope you all have some good questions because I need to make up a little time. I thought this seemed to be appropriate for our final cartoon. And let this be a warning about stealing identity.
Hey, Jerry, you have not advanced your slides for a while now.
What? They are on mine. What slide are you seeing?
I'm seeing Social Security planning opportunities. It could be my internet connection. Anybody else?
Yes.
I've got the same thing, Rich.
Same here.
What?
So you're gonna have to start all over again, Jerry.
You'll have to stay till after 5 o'clock. So these aren't numbered. So is it the first page or the second page of the planning opportunities? Does it say continued at the top?
First page.
So it didn't just flip to the second page?
That or we've missed some cartoons.
So are you seeing planning opportunities continued?
Nope.
Jerry, we see slide 24.
Let me try a different view. Now, did you see me switch my view just now?
No.
Kim, are you online?
Is this your strategy to kill time?
It's working, whatever.
Hey, Jerry, try ending your screen share and then restarting it.
Okay. Okay, I just restarted sharing.
Yep, that's better.
So are you seeing the cartoon now?
Yep.
Okay, well, perfect. This will get me to our full 50 minutes. So you're seeing the future changes here?
Correct.
Perfect. So I won't go over all of these. I mean, you heard me talk about them, but they are here. So if you want to peruse over them again. The next slide was the additional resources. And again, there's so many resources out there on the internet. I probably didn't even need to give you these, but there are some that I used that I liked. Again, here's the list of the handouts that I have that shoot me an email or drop something into the chat if you want me to send you these PDFs. The glossary, the benefit, early and delayed benefit charts, the 10 Medigap policies, and then a projection of the benefit cuts needed. And here's my last slide. So, questions? Let me see. My chat box is really small. So Robbie asked, if you sign up for Medicare only at age 65, but delay Part B to avoid the monthly income offset look back. I'll be honest, I have no idea. I mean, nowhere do I remember them saying that, if you didn't sign up for Medicare B at 65, then, you would have a lifetime increase in your coverage. I'll check into that and let you know. Be good for me to learn anyway. Rich had a question about whether our firm had any of the software. We don't at this point in time. I started studying this a little bit about a year ago. I've actually only really helped one client with a Social Security issue. I think, a lot of our clients, if they use personal financial planners, they probably help a lot with this type of thing. But again, they're pretty reasonably priced. So it's probably something that, I'll ask if, we might get one of these. Put that, oops. Yeah. So here was the list again. Again, I do think they're pretty reasonably priced. We could probably practice on some people within the firm. So any more questions? Everybody got all their code words? Well, I've got 441. Supposed to go to 445. So my last slide. Thank you, everyone. I hope you enjoyed today's CPE. And I hope everybody has a wonderful Christmas and Happy New Year. Can't wait.